Okay, this video presentation is going to cover mostly Chapter 24, Care of the Patients with Cancer. Again, we are just talking about cancer in general, the general effects that it has on a patient. It is important to understand that somebody who has cancer of any kind is at risk for having altered body system function, depending on where their cancer is. A big part of it is it does affect their physical and psychological functioning. That's something for the nurse taking care of a patient with cancer to just understand that to some degree their physical and psychological function is going to be impaired, and we need to determine what those are for each specific patient and determine their needs. Cancer can be treated with multiple types of surgeries. And this is a list of just the different types of surgeries that can be done. Typically, the prophylactic can be done sometimes just to remove something that has not spread and just to prevent any further issues from happening. We talked about sometimes patients might have an organ removed or some kind of part of their body removed prophylactically because they feel they're at risk for getting cancer. So that's a type of surgery they can have. Sometimes it's diagnostic, which would be a biopsy to determine if something is benign or metastatic. Hopefully, sometimes they can do a curative surgery where they can actually remove all of the cancer. And then in other times it can be palliative, which means that they just remove something that is causing discomfort to the patient. It's not curative, but it's just more of a comfort measure. So different types of surgeries can be done for these for a cancer patient. Radiation therapy is a cancer treatment that uses high doses of radiation to kill cancer cells and stop them from spreading. Radiation therapy can be given external beam radiation, or it can be given internal. It can be used to cure, stop, or slow the growth of cancer. When a cure is not possible, radiation may also be used to shrink cancer tumors in order to reduce pressure and help a patient with comfort. It might be kind of a comfort palliative measure as well. It can be used in this way to treat problems such as pain, or it can prevent problems such as blindness or loss of bowel and bladder control. Radiation not only kills or slows the growth of cancer cells, it can also affect nearby healthy cells. The healthy cells almost always recover after treatment is over, however, but sometimes people may have side effects that do not get better or are severe. It's the goal of radiation therapy to cause as little side effects as possible. They try to use the lowest dose of radiation possible. They try to spread treatment out over time, and then they also try to aim the radiation at the precise part of the body that has the tumor. And they can use some medications to protect certain parts of the body. External beam radiation therapy comes from a machine that aims radiation at the cancer. The machine is large and it may be noisy. It does not touch the patient but rotates around the patient, sending radiation to the body from many directions. External beam radiation therapy is a local treatment, meaning that the radiation is aimed only at the specific body part. For example, if the patient has lung cancer, you get radiation to the chest only and not the rest of the body. This type of radiation therapy is typically done on an outpatient basis. This means they will get the treatment at the treatment center and then they will go home. Internal radiation therapy is a form of treatment where the source of radiation is put inside the patient's body. One form of internal radiation therapy is called brachytherapy. In brachytherapy, the radiation source is a solid in the form of seeds, ribbons, or capsules, which are placed in the body near the cancer cells. This allows treatment with a high dose of radiation to the smaller part of the body. Internal radiation can be used in a liquid form. They can receive liquid radiation by drinking it, by swallowing a pill, or through an IV. Liquid radiation travels throughout your body, seeking out and killing cancer cells. Brachytherapy may be used with people who have cancers of the head, neck, breast, uterus, cervix, prostate, gallbladder, esophagus, eye, and lung. Liquid forms of internal radiation are most often used with people who have thyroid cancer or non-Hodgkin's lymphoma. They may also get internal radiation with other types of treatment. Types of brachytherapy, there's 3 types. There's low dose rate implants. This type of brachytherapy radiation stays in place for 1 to 7 days. They are typically hospitalized during those times. And then once the treatment is finished, then the patient's able to go home. High dose brachytherapy is high dose implants, and the radiation source is in place for 10 to 20 minutes at a time and then taken out. And they may have the treatment twice a day for 2 to 5 days. The schedule depends on their cancer. Third type of brachytherapy is permanent implants. After the radiation source is put in place, the catheter is removed. The implants always stay in the body while the radiation gets weaker each day. They do have to limit their time around other people when the radiation is first put in place, especially around patients that are pregnant or family members that are pregnant. As time goes by, almost all the radiation will go away, even when the implant stays in the body. When a patient does have radiation in place, like the high dose or the low dose, they have to stay in a private hospital room to protect others from radiation coming from the body. The staff, the nurses and hospital staff are treated quickly. They do provide all the care they need, but they must stand a certain distance away from the patient, and it's going to have to be an education thing to help the patient understand why they have to stay a certain distance from the patient. The visitors are going to have to follow a lot of safety measures. They probably won't be allowed to visit during the radiation treatment. Patients' families will need to check with hospital staff to determine whether they're allowed to go into the room. If they are allowed, the visits will be very, very short, and they might be able to just stand at the doorway rather than going into the hospital room. Usually they will not let children younger than 18 or pregnant women visit at all. They have to follow all safety measures once they leave the hospital. They may have to stay away from kids and pregnant women for a while, as well as when they go home. Many people who get radiation therapy have skin changes and some fatigue. Other side effects depend on the part of the body being treated. Skin changes may include dryness, itching, peeling, or blistering. These changes occur because radiation therapy damages healthy skin cells in the treatment area. You need to take the patient will need to take special care of their skin during radiation therapy. Fatigue is often described as feeling worn out or exhausted. And there's many ways that the patient can manage the fatigue. The skin side effects in many ways can look as if someone has a mild or severe sunburn. They can have itching. It could just be a lot of scratching due to dry skin. The skin side effects can be relieved by taking extra good care of the skin during radiation therapy. Do not rub, scrub, or scratch in the treatment area. Also, use creams that the doctor prescribes. Typically, these are creams that are very, very mild in that they don't have perfumes in them. I think aloe is one of the favorites of most of the physicians because it's more natural and it doesn't have perfumes in it. They should not put anything on their skin that's very hot or cold, and this means they should avoid using ice packs or hot or cold items to treat the area. It also means washing with lukewarm water. They should be gentle when taking a shower. Use lukewarm water rather than hot water. Use mild soaps and try to avoid things that have a lot of fragrance or deodorant. Dry with a soft towel by patting, no rubbing the skin. And be careful not to wash off the ink markings that they need for the radiation therapy. Fatigue can be managed by getting enough rest. Make sure you sleep 8 hours each night. Plan rest times. If there's a nap needed during the day, go ahead and take a nap. They should limit their activity so they can save their energy. If they want to exercise, it's always good to exercise, but maybe try some exercises such as yoga, walking for 15 to 30 minutes. Mild exercises are probably the best exercise for them. The fatigue happens for a lot of reasons. It can be a lot of the complications of the cancer itself, such as anemias, infections, and then it also can be related to some medications that they're on. Depression, anxiety can also lead to the fatigue that they get. The fatigue will actually also vary according to what kind of cancer it is and to the age of the patient and the general health of the patient prior to the diagnosis and the treatment. Diarrhea is another side effect that might occur related to radiation. Sometimes this happens especially when somebody's getting radiation treatment to the pelvis, stomach, or abdominal area. If they have cancer cells, or the radiation might harm the healthy cells in the large and small bowels and can cause some GI upset. Ways they can manage this is to make sure they drink a lot of water, get enough fluids, eat small snacks, small meals, and then stick to foods that are easy on the stomach, something low in fiber. Stay away from milk and dairy, spicy foods, caffeinated drinks. It's the best way to manage any kind of diarrhea side effect. Hair loss associated with radiation can occur because of the damage. The radiation is damaging the healthy cells that were the roots of the hair. It typically will only happen in the area of the body that's being treated. Hair loss can be managed by, of course, they can help the patient to find a place where they can buy a wig. They also need to make sure that they use gentle soaps to wash their hair. They shouldn't use curling irons or hair dryers because it can damage their scalp. And do not use products that are harsh on the hair. Protect their scalp by using a hat, scarf, something like that to make sure they protect their scalp from the sun. And always even also consider wearing a hat when it's cold outside just to protect their scalp as well. These items I've already spoke about. It's just continuing ways of helping a patient cope with the side effects of radiation. An extra side effect listed here is the dry mouth. They can have mouth changes, and I think I mentioned earlier the fact that it can leave a foul taste in their mouth as well, or a strange metallic taste. They also can get dry mouth. Some other things they can get is some mouth sores, loss of taste, tooth decay, definitely changes in taste of the foods, infections in their gums, jaw stiffness. Ways to manage this is to visit the dentist at least 2 weeks before the treatment starts. The dentist can examine the teeth and go ahead and do any dental work that needs to be done, kind of as a baseline visit to the dentist. The patient should inspect their mouth every day to determine if there's any sores in there. They need to keep their mouth moist, sipping water often during the day. Ice chips are great for that. Chewing gum can help with that. There are some saliva substitutes available. Ask the doctor to prescribe something if it's really getting severe. Clean their mouth and gums gently with each meal and at bedtime. Use an extra soft toothbrush. Do not use mouthwashes that contain alcohol because those can cause dry mouth as well. They should rinse their mouth every 1 to 2 hours with a solution of baking soda and teaspoon salt if the physician thinks that is something that they could do. If they have dentures, they should make sure they fit well, and they should keep their dentures clean. Okay, moving on to chemotherapy. Chemotherapy is chemical agents used to treat cancer cells. The mechanism of action for most of the chemotherapy drugs is that they have the ability to somehow alter the DNA or synthesis of the cancer cells. So by altering that, they alter their ability to expand and to grow. So if we are able to alter their DNA makeup, we can stop the growth and kill the cells. The use of chemo is typically the same as we talked about with HIV drugs. They typically use 2 different types or multiple forms of chemotherapy so that they can stop the growth of the cells, the cancerous cells, in multiple places. It's more effective that way if we use more than one type. Chemotherapy can also affect some of our healthy cells as well. Most of and these are listed there, the normal cells that are most affected is the skin, hair, intestinal tissues, spermatocytes, and blood-forming cells. Typically, why those cells are so much affected is because they're our most rapidly changing cells that occur naturally in our body. So the chemo typically will affect those cells because they're typically targeting cells that are rapidly changing. These are the many classifications of chemotherapy drugs. They are listed on page 415 of your book, and kind of described a little bit as well there. So look that table over, it's table 24-2. It is called combination therapy when more than one is used. Using more than one drug is more effective in killing cancer cells than using one single drug. Side effects can damage normal tissues, also increase with combination chemotherapy. An oncologist will prescribe the chemotherapy. There are doctors that specialize in cancer, and they will be the ones that prescribe the chemotherapy and determine, according to what type of cancer it is, what type of cells they are, in order to determine what chemotherapy treatment the patient needs. The IV route is the most preferred route for administration of chemotherapy. Chemotherapy can only be administered by nurses who have special training. They are specially certified to administer chemotherapy because there is a lot of side effects. There's a lot of potential complications of chemotherapy. They are toxic medications if they are used in the wrong way, so the nurses have to be specifically certified and educated to do so. Most chemotherapy drugs are vesicant, which means that they are chemicals that damage tissue on direct contact. So special precautions have to be taken to administer these medications so that they don't cause a serious complication called extravasation. Extravasation is an infiltration of the drug leaking into the surrounding tissues. There's a good picture in your book, and I believe there's a picture in these slides of an example of extravasation. If these drugs leak out of a peripheral IV into the tissue surrounding it, they can actually burn the skin and cause permanent damage. Because of the risk of extravasation, most chemotherapy patients will have a central line, which probably you might have heard of somebody getting a port, which is a central line. A central line is where the medication will be administered through this line and right directly to a larger vessel instead of just the peripheral vessels. The peripheral vessels are very small, and there's a high risk for them to infiltrate or extravasate. So most chemo is administered through a central line, which would be in somebody's subclavian area, through a port. So that decreases the risk of extravasation in those peripheral sites. And here's that picture of the extravasation where it has burned the patient's hand because it has leaked into the tissue. And again, I just want to stress the fact that that is why all patients that are getting chemotherapy through an IV are going to get a port or a PICC line, something that is centrally going to a larger vein, so it decreases the risk of this happening. There are some oral drugs out there, oral chemotherapy drugs. They are listed on page 418, table 24-3, current oral chemotherapeutic agents. You can look that over and just see the different reasons why those might be given. There's some I can see that are listed as for ovarian cancer, breast cancer. So they're taking them orally. It's important for the nurse to know that even though these are oral, a lot of care has to be taken for the patient getting them and for the patient handling them. Typically, a pregnant caregiver, if the nurse is pregnant, is not allowed to give these. They can't even touch them because it can be distressing to the fetus. So just look those over and just be aware. There's a lot of guidelines that regulates the administration of any of these chemo meds, and a lot of personal protective equipment has to be worn when administering these medications, and if there's any extra that they need to waste. A lot of specific guidelines that are in place to make sure that everybody's protected. There are a lot of side effects involved with a patient that's receiving chemotherapy, and that's because of how some of this chemotherapy, along with killing the cancer cells, can actually affect the normal cells and affect the normal function. The side effects of chemotherapy treatment are many, and that's due to the fact that these are administered typically systemically and can have effects systemically on the entire body system. So begin to review all the drugs that are listed on your topical outline, review each classification, and review the common side effects of the classifications of these drugs. Specifically, alkylating agents. If you look at specific things like cytotoxin is cyclophosphamide, and that one's famous for its effects on the bladder. It can cause cystitis in a patient. So look for outliers like that, specific side effects of these medications. Most of them will cause nausea, vomiting. They can get alopecia, where they lose their hair. And then the next step is to begin to determine how a nurse handles a patient with these side effects. So, for instance, thrombocytopenia can be a side effect. Basically, it can cause leukopenia, which causes low white blood cells, thrombocytopenia. They're anemic from low red blood cells. So think about how that would affect their care for the nurse. So if they have thrombocytopenia, what safety measures do you have to put in place? Because they have low platelets, they're going to be they're going to bruise easy, they're going to bleed easy. So think of all the safety things that you have to put in place for somebody with thrombocytopenia. One of the important things about thrombocytopenia is they are at high risk for bleeding. So you need to make sure that if they fall, you determine whether they have any obvious bleeding, but you also have to take into consideration if they have any internal bleeding, because they are at such high risk for bleeding. One of the biggest signs and symptom that they might have a head bleed. So what if they fall, kind of bump their head? The typical person would be fine, but somebody with thrombocytopenia, if they fall, they could actually get a head bleed that could be life-threatening. So one of the first signs and symptoms of a head bleed is a change in level of consciousness. So you have to remember those types of things for safety for your patients. As far as anemia, they're going to be weak, they're going to get short of breath. So you're going to have to make sure that you prevent them from falling, because they're going to fall easily when they're short of breath and they're tired and they're fatigued. So just think about all those things that you're going to put into place for all those patients. Leukopenia, the low white blood cell count, you're going to do all the precautions to prevent them from getting infection. You're going to teach them how to prevent themselves from getting infection. A big side effect of the chemotherapy can be getting sores in their mouth, getting infections in their mouth, and that prevents them from being able to eat, which is not good for them. They need to be able to eat. Most of the time we need to encourage high protein, high calorie meals for these patients, because their body is so compromised. They need the calories, they need the protein to heal, especially if they're getting radiation on top of it, because it helps their skin heal. So think about all those things that a nurse needs to do to assist a patient that's getting chemotherapy. The other thing worth mentioning here is the fact that there are antiemetics for patients who get the nausea and vomiting from the chemotherapy. It is very debilitating for a patient to be so nauseated that they can't keep anything down. They're losing weight, when that's exactly the opposite of what they need to be doing. They need to be being able to maintain nutrition. There's a lot of medications that we can administer. Zofran is one of the number one drugs that we give these days, which is ontidestrone. It's a medication that we typically, a lot of times they'll give them preventive. They'll just go ahead and give it to them even before they get nauseated to prevent them from getting nauseated. So that's something that you might need to educate a patient on, that we might go ahead and just give it to them to keep them from getting the nausea and vomiting, to try to help them through and keep them with the nutrition status that they need to heal and get better. There are multiple tables or charts in your book between page 420 and 422. All those charts address how you prevent complications related to side effects of chemotherapy, so make sure you review those. Hormone manipulation is another form of treatment for cancer, and it's for specific types of cancer. We talked about how some cancers need a promoter to grow and become virulent and be able to spread. So they've figured out that these hormone manipulation medications can actually block that hormone promoter from allowing the tumor to grow. These drugs are hormone inhibitors, hormone antagonists, things like that. There are some side effects. So if we are giving, a female perhaps maybe some androgens or some testosterone as an antagonist hormone treatment, then the female may get some masculine facial features such as chest hair, disruptive menstrual cycles, and things like that. So there are a few side effects associated with these. They are manageable and they are temporary, however. This is just a list of the side effects of hormone therapy, and they all sort of make sense, because if you're messing with somebody's hormones that affect their growth and their puberty and their all of their organs, their sexual organs, then you're going to have these side effects. This is just a picture of an example of gynecomastia that could occur in a male if he's taking female hormones in order to block the testosterone from causing a cancer. So sometimes they'll give them like hormone A to block hormone B, the effects of it. So they'll give them like a different hormone to kind of block the damaging hormone. So this is just an example of if a male's taking a female hormone, he could end up with the gynecomastia. Photodynamic therapy is another form of treatment for cancer. It's only used for certain types. Typically, it can be used for non-melanoma skin cancers, but it's basically the use of photodynamic light. It's like a laser light to destroy some cancers, and it's very, very specialized treatment for cancer. So this immunotherapy biological response modifiers, which are typically cytokines, are used to enhance the immune system. It's a very interesting thought process to treat cancer. So basically they sort of beef up the immune system so that it can see the cancer cells as something foreign to the body, and the immune system itself will fight off the cancer cells and destroy the cancer cells themselves. Interleukins are the classification of drugs that are in this category. It's a group of 37 known substances that the body makes to help regulate inflammation and immune protection. So they man-make these, and they give the patient these drugs to, like I said, beef up their immune system to enhance the killer cells. A lot of times they'll use this as like an adjunct therapy. So along with giving chemotherapy to somebody to kill the cancer cells, they'll beef up their immune system at the same time to sort of give them another way of fighting it, and a whole nother thought process of fighting these cancer cells. There are some side effects, and that's typically related to an exaggerated inflammatory response, and so we've beefed up the immune system maybe a little bit too much, so they'll get like an exaggerated inflammatory response, which will cause some swelling. It can cause some skin issues, or they can get symptoms of like an infection, like an inflammatory response, like fevers, chills, flu-like symptoms from these medications. Targeted therapy is very specific. It has to be a certain kind of cancer. Sometimes they'll do a lot of DNA testing in a patient to determine whether this targeted therapy will work. These drugs will not work unless the cancer cell overexpresses the actual target substance. So it has to be, like I said, very specialized for targeted therapy. So they'll take the patient's cancer cells and look at them and determine if they have enough of the target to be affected by the targeted therapy. So they take a look at it and see what characteristics the cells have. So like I said, this is very specialized treatment for cancer. Epidural growth factor receptor inhibitors is just another classification of a specialized chemotherapy or treatment for cancer. Superior vena cava syndrome is just a life-threatening side effect or complication that can arise from a patient's cancer. Typically, it's if there's a tumor in the upper part of the body that can obstruct the superior vena cava. Superior vena cava, if you think about back in your anatomy class, it's what drains the blood from the upper part of the body, the head and the neck, to the heart. So if there's a tumor that obstructs the superior vena cava, the blood will get black, kind of backed up into the upper part of the body. So the manifestations of it is you're going to see that the upper part of the body is swollen. There's going to be facial edema, neck edema, especially around the eyes. You're going to see a lot of edema, and it's sort of going to compress that blood to where it's engorges all the blood vessels in the upper part of the body. There's a picture in your book with these. You can see like they engorge. The vessels are very clear at the upper part of the body. It's a late stage, superior vena cava syndrome is a late stage manifestation that the tumor is pretty serious and that it's widespread. They can do some high dose radiation to try to shrink the tumor in the chest area in order to treat this. Sometimes they have to take them in to do some surgery to see if they can open up that vessel, try to remove part of that tumor to open that up so that the blood flow can be returned. This is just a picture to give you a visual how perhaps maybe there's some lymph nodes there near the superior vena cava that can actually get a tumor in it, and that's what can cause the superior vena cava syndrome and the symptoms of that. This is that picture. It's in your book of the lady that has the engorged vessels, and that's what you can see in a patient with superior vena cava syndrome, and it will get worse as the disease progresses. This is a case study that you are welcome to do on your own, and that concludes this portion of Module 3.